Hey guys, good afternoon. It's Donna again. I don't know if you remember yesterday, I posted a video on uh, treatment centers and what questions you should ask when you are thinking of putting a loved one of yours in rehab, or if you yourself need to rehab. And I discussed with you about, what credentials the professionals at the treatment center should be holding. So just for kind of shits and giggles, I Googled a treatment center that's local here in Florida, who say they offer pretty much the same services that the place that Alex is at offers. And so when I looked at their credentials, their the chief executive officer was a businessman, and their medical director was a doctor of osteopathic medicine. Why not a psychiatrist? Why not an addiction psychiatrist? In any event, today I wanted to talk to you about whether or not, when you go to a place, a lot of times you're looking for a place that will treat comorbid diagnosis. And when I say comorbid diagnosis, I mean not only drug usage a disorder, but something like schizophrenia or bipolar disorder, something like that. A lot of times places will say that they treat these illnesses, but more often than not, you're going to find that they don't. So when you ask these questions, when you visit, ask the doctors, the staff, what kind of interventions they provide. Do they do any cognitive training for patients with schizophrenia? Do they provide clozapine for schizophrenics? Because clozapine is the best medicine on the market, according to research. And let's see, what else should you ask? You want to find out what the level of care is that they offer. Is it going to be a 28-day program and then you're out the door? Or are there like step down levels of care? And that's it. I don't want to bombard you today. So have a great day and think about what I said. You want to know what kind of credentials the staff has, and you also want to know if they treat comorbid diagnoses, and ask them, how do they treat these comorbid diagnoses. Have a great day. Bye.